I don't know if you've ever tried to do an interview, try to interview somebody else and try to get information, especially accurate information from somebody through an interview. It's actually a pretty tricky thing to do. And there's lots of elements that relate to test administration because of things like rapport and other stuff that help to improve the outcomes of interviews. But as an assessment process, it actually takes a lot of practice. So you end up having to sort of juggle many things at one time. You're trying to establish rapport and connection and make sure, keep eye contact and, all this stuff with the person you're interviewing, while at the same time trying to learn what you can about the person through the interview, all the time, then also trying to make sure that what they're saying is actually complete and coming up with sort of follow-up questions without seeming like you're trying to interrupt them or not really listening. It's a pretty difficult thing. So if you actually find a really good interviewer, those are things that are difficult to do, and it takes often there's a lot of practice and training and just doing it over and over again to be able to become a good interviewer. So many fields rely on interviews to gather information, job seeking, especially like in businesses and stuff like that. Even, contractors. Right? So my dad was a general contractor, and a big part of the, thing was if he first meets a customer, that initial conversation that they have is really, it's really an interview. They're trying to decide whether or not they want to hire you to do a job. They're really trying to feel out every sort of part, your personality, your trustworthiness. They seem like you have the skills, the training, the background. So that's true of all things. You go into a job interview, every little thing seems to be on display in terms of relevant to getting that job. Psychology, obviously, but not just clinical. I should say counseling, not counseling. So psychology, obviously, there's lots of reliance on interviews. So even industrial organizational, when people are doing restructuring for a company and they want to interview the employees to sort of figure out where they fit in the new structure, it's going to rely a lot on interviewing techniques. Forensics, counseling, and lots of other areas within psychology rely on interviewing skills. Businesses do lots of research is done through interviewing and doing sort of more qualitative research as opposed to quantitative, where we take interview transcripts and then look for themes, that kind of stuff. We see in all the movies and stuff, which probably is not super accurate, but look, even when someone's on the stand and you're sort of asking the questions, trying to get at the truth, it's really a form of interview. And anytime someone is asking questions of someone trying to get answers, it is a form of interview, and you can be better or worse at it. And there's all kinds of tricks and things people will tell you to sort of become a better interview, and some of them work and some of them not so much. But an interview is just like a test. So again, this is a class on psych testing, and oftentimes we think of interviews as separate than tests, but they're not. An interview is just essentially a verbal test. Right? Oftentimes there are interviews to assess people's mental fitness, to assess their aptitude, to assess all kinds of things can be done through an interview instead of through a paper pencil test or something. So interviews are just alternative format for testing. So like a test, you're going to gather data. We're going to use that to make predictions. We can ascertain reliability about the interview and the validity of the interview. You can do group interviews versus individual interviews, and they can be structured or unstructured depending on what you're getting at, what the point is of the interview itself. So some interviews can be standalone tests all by themselves. Employment interviews, psychiatric interviews, medical histories, all those things oftentimes are used alone as sort of indicators of things. So you go into an employment interview, yes, you have your application there, but the application was enough to sort of get you in the door often, but the interview itself is sort of a test for how well you will fit the job and the company and that kind of stuff. Psychiatric interviews, trying to diagnose people using, sort of guided by the DSM. but the psychiatric interview is still sort of a test of trying to put you on a scale of, are you bad enough to need medical intervention versus, could you do it as an outpatient, maybe drug treatment versus, you're totally fine or whatever. It's usually used in conjunction to other types of tests. So interviews are oftentimes done alongside like the thematic apperception test, which we'll talk about probably Tuesday. The TAT is a thing where it shows you like a vague picture or something, like a scenario, and then you're supposed to write a story, like how did people get to that scenario, what happened in the scenario, and what was the outcome of the scenario. And based on what you write, they can then sort of pick up on all kinds of themes related to different types of psychological disorders or mood issues and those sorts of things, perceptual problems, that kind of stuff. It's funny, just reminding me of this whole thing is, this is being recorded, and it's likely I'll be using this again later, but to sort of put a timestamp on this particular thing, as we're talking about testing, is that currently the President of the United States is sort of touting this test that he took as proof that he is sort of mentally fit to be president. And I forget the name of the test, but it's literally the test. It has progressively sort of more difficult questions, but none of them get very difficult at all. And the fact that he thinks, one, that he thinks the test is hard is sort of a little weird. And two, that he's in the middle of a pandemic and racial inequality sort of driven riots in the streets and all kinds of crazy awful things happening. He literally had a press conference, I think yesterday, and the sole purpose was to convince people that this test he took meant that he was a genius. Which is, it's sort of, it would be, so it's terrifying, but also sort of surreal at the same time. The reason I mention this too is because tests can only do so much, and tests are designed oftentimes for certain things. And I don't know for sure, and it was something I was going to plan to do today. The particular test he's taken, I'm pretty sure, I'm not 100% sure, so don't quote me here. And maybe if you find out, please let me know. The test he took, I'm pretty sure, is a test that looks at if you have a cognitive like disability or impairment, like dementia or something. It's not meant to prove that you are somehow a genius, or it's not an intelligence test. It literally is looking for, did you have an aneurysm? Did you have head trauma? It's sort of to decipher that as a tool to look for symptoms of cognitive impairment. So that's sort of terrifying a little bit. But oftentimes, going back to what we're talking about here, tests like that, tests like the thematic apperception test and other things, are often used in conjunction with an interview. So the doctor that gave them that test, there was likely more to it. There was interview questions and other things to try to judge mental fitness and things like that. And even the way he described the way the doctor talked to him, as if the doctor was talking to like a toddler, Wow, I'm really amazed that you did that well. The whole thing is sort of really weird. The more I see, the more I learn about it, the more I'm like, this can't be for real. I feel like I'm watching some weird dystopian movie. But it does relate back nicely to this. So related to this course, if you're interested in sort of, follow that story a little bit. Because interesting is that it's an established test that they used, but he is claiming the outcome to mean something other than what the test was designed for, which is interesting. Anyway, I digress. So in ways in which, interviewing, sort of the goals of an interview. So with interviewing, unlike test administration, where establishing rapport is suggested and actually can increase the respondents' scores and things, interviewees have to establish rapport. You have to be able to, unless the whole point of the interview is to be combative, oftentimes you want to be able to put the person being interviewed at ease, make them feel comfortable, so that they'll actually talk to you, right? So an interview isn't very good if the person being interviewed doesn't talk and doesn't share information. So we want to be able to gather information efficiently So instead of having a survey where it asks a bunch of questions that are irrelevant, I'm able to ask a couple questions, find out some information, and then be able to then go down, be able to change direction, go down and follow up on questions where there seems to be more information. Or a survey can't do that. A survey can't adapt in that way. Even computer adaptive tests don't know how to adapt in that way. So interviews are important for being able to do that, being able to adapt to the information that's being provided by the interviewee so that it can actually get more information and do it sort of efficiently. We want to be able to form clinical impressions. So, especially in the field of psychology, our interviews with patients, clients, oftentimes we're trying to form an impression. What seems to be things that are driving this person? What are their interests? What might be the roadblocks or things that are impeding upon their happiness? Those kind of things. We're all trying to form these kinds of impressions all during this interview, which is why I was saying that interviewing is a lot like juggling. You're trying to form these impressions and gather accurate information, at the same time making the person feel comfortable and sort of, trying to keep all this information in your mind while trying to decide what other information you need. It can be really mentally taxing to do an interview and to do it really well. Most of the time, interviews aren't done sort of in a vacuum on their own. They're done to supplement other testing information. People have taken other scales, other assessments, and now the interview is to then supplement the information from those. Like if you know someone scores high in an anxiety inventory or something like that, you may then modify your interview to ask more questions about that and be able to adapt to addressing the sources of their anxiety. All right. Because interviews involve interactions between people, it's natural that both the participants are affected. So this is the reciprocal nature of interviewing. And when people think about clinical treatments with psychologists or psychiatrists, the focus is often on the person who's being treated. We rarely think about, what about the person who's treating that person? And all of the theories by Sigmund Freud, most of them have sort of been debunked or, seen as sort of, fringe or sometimes just the cocaine-induced ramblings of a person. But a couple things he got really right, and there's still a lot of stuff he did get right, even though it may be a little bit out there. If you take it to the extreme, is this idea of this reciprocal nature that not only do the clinicians, the psychologists, the counselors affect their patients, their clients, but they also in turn, the clients actually can affect their doctors, their counselors. Because interviews involve interactions, right? They're affecting one another. In criminal investigations, if the subject becomes more active, meaning more, hands are going more, becomes more agitated, the interrogator often will also become more active and agitated. And sometimes the person being interrogated will use this to their advantage by getting the interrogators riled up so that they'll make some kind of mistake, like getting rough with them or something like that, so they can actually use that against the interrogator. You've seen scenarios like this probably in a lot of movies, but the people tend to mirror each other's behavior. People get more active, the other person tends to get more active as well. If you've ever been in an argument with somebody, as soon as they start to raise their voice, you feel compelled to raise yours, and it's sort of there's a climbing up of things is going on, and it's sort of funny because that is the tendency for people to do with arguments. And I noticed a long time ago as a kid that if someone is getting mad and starting to yell and scream in an interview or in a conversation, I noticed a long time ago, this may be, I don't know if this is either genius or it's like super evil. I realized that if I got calmer and quieter when talking to them, that it would drive them nuts, because I wasn't responding in the way they wanted me to. I was actually getting more calm, more relaxed, and not biting on their their lure, trying to get me to get into an argument and fight. So sometimes if you actually respond in a way that is opposite, you actually can break that sort of cycle of mirroring other people's behaviors. It can actually have some interesting results, outcomes. You can actually help to sort of bring the level of things back down again, but you have to sort of consciously do that. This can inadvertently lead to the suspect being viewed more suspiciously because the interrogator gets more active, the person who they're interviewing becomes more active, more agitated, then all of a sudden now they're more suspicious. So they can really impact one another. There's lots of other examples. If people not just more active, but if they become more expressive. If people lean forward, the kinds of things that they do while being interviewed, oftentimes people will mirror that, even if it's unconsciously. They'll start to mirror the behaviors back to that person, sometimes on purpose to make the person feel more at ease. And that's something that interviewers will do, is to sort of do a slight mimicry of a person's, posture and other things. But sometimes it's done inadvertently and sort of unconsciously, subconsciously. Other studies, again, these are all old, have shown that when actors responded with anger to highly trained interviewers, the interviewers reported them becoming angry themselves. So even if they had someone go into an interview and they had the person pretend to get angry and get agitated, the interviewer started to feel angry and stuff in response. That again, we tend to mirror each other's behaviors, and that's actually why things tend to escalate pretty quickly. And this is why it's important that when people are talking about, again, another topic that's sort of big right now is this whole defund the police, and this crazy notion that police officers shouldn't allow themselves to escalate. The whole point of being trained and that kind of stuff, and having all the support and resources they have, is so that once things escalate, a person who is suspected of being a criminal, if they get violent, they do stuff, the police officers are supposed to remain calm and supposed to be able to not escalate the situation and actually de-escalate it. And it's because, again, there is this social facilitation that occurs between people that we naturally want to match the other person's behavior and interactions. So you need training to sort of go the other direction. If I need to stay calm in the face of someone who's freaking out and yelling and screaming at my face, that has to be trained. It's not something I naturally want to do. I naturally want to respond back in the same way, and that's what happens. Except the police have guns and nightsticks and pepper spray, and there's usually a lot of them. And so when things get out of hand and they respond aggressively, it's oftentimes tenfold, 20, 50, 100-fold to the person's sort of initial aggressive behaviors, which is why things get out of hand, all this stuff gets crazy. And that's without bringing in the fact that there's likely other things too, racism and other motivations for those things that they're coming in that make it even crazier. But even without those things, it can be explained in those ways. So social facilitation, just to expand on that, we tend to act like those around us. So you may have heard this phrase used in a developmental or a social psych course or something like that, where you've heard the social facilitation oftentimes is matched with something called social loafing. It's this idea that if you started a job and everyone there in the job is sort of working really hard, you'll likely start to work harder to match the level of behavior, the level of activity that they are doing. Another example that gets used is that Olympic runners oftentimes will run faster, break records during official races with other people because they're running against other people who are also very fast, other Olympic runners, and that social facilitation pushes them to run harder and faster. Right? So this is all sort of social facilitation. The opposite is, if you started a job and everyone there, has sort of a low level of activity, people are sort of lazy and they're not really very active, or they don't work very hard. You come in and you work real hard and you're sort of knocking it out of the park. Eventually, you're going to get a lot of feedback from those other people working there that they don't like that so much, and you're going to see yourself sort of working harder than you need to, and eventually you're going to slow down. that social loafing is that your level of activity is going to lower to match those around you. So we tend to act like, or to match the level of behaviors and activity and stuff of those around us, and they have that impact on us. So if the interviewer is tense and uncomfortable, nervous, it's going to make the interviewee feel more tense and nervous, right? It works during interviews as well as during crisis interventions. Again, talking about the current scenario with the police and things. Anytime people interact for extended periods of time, they're gonna start to match. They're gonna try to sort of find sort of each other's behaviors. And yes, if a client, an interviewee, is calm, it should have the same effect to calm the interviewer as the interviewer being nervous has at making the interviewee nervous. So it's if someone's nervous, someone's calm, it's not like this person goes right over there, right? Oftentimes, they will sort of meet in the middle. This person now becoming more anxious, the other person becoming less, but there's still an increase in anxiety. And once they get to the same point, it's likely they might build on each other and raise back up to a higher level of anxiety that they were at in the first place. All right. Since social facilitation has a strong behavioral influence on both the interviewer and the interviewee, it's easy to see that it can lead to bias in an interview. You can also see how people can use that to make an interview go in a different direction, or in a direction they want it to go. So if you're an interviewer that wants to make the interviewee look bad or look guilty, there are things you can do to actually help that happen. Same thing if you want someone to look less guilty, there are things you can do to help that happen. So there's a certain social facilitation that if you know that's going on, you can use that to your advantage, or you can use that knowledge to be a good interviewer and actually help to sort of eliminate some of that stuff. If an interviewee is getting agitated, becoming more calm will actually help to bring them back down again. A good interviewer will be aware of the power of this and try to combat it. So again, it's another thing as an interviewer. Not only am I doing juggling all these things at once, I'm now trying to almost have a meta view where it's like, all right, I need to see what's happening between us in terms of social facilitation, and then decide how to act to undo it. So it's a lot of things to sort of keep in mind all at the same time to be a good interviewer. So principles of effective interviewing. So going into an interview, you need to have a proper attitude, right? So you know that there's going to be a certain amount of interpersonal influence, which is the degree to which one person can influence another. This goes back to social facilitation. So going into it, your attitude needs to sort of be appropriate for what you're doing. This is related to interpersonal attraction, the degree to which people share a feeling of understanding, mutual respect, and similarity. So this proper attitude that you're sort of portraying to the interviewee, all really comes back to rapport, right? You need to make sure that the person feels that you respect their position, you understand what they're doing, that you can identify what they're talking about, that you're not being judgy of what they're saying. All those things are important to get people to sort of be honest and forthright in their interviews. Okay? The most important factor in a patient's evaluation of interviews, the perceptions of the interviewer's feelings. Right? Sounds weird, but when the interviewer was seen as cold or defensive or uninterested, uninvolved, aloof, or bored, the person saw the interviewer as being poor. This is sort of true too, not just of interviewers in general, but of clinicians. If you go to see a counselor or clinician and you feel like that what you're saying to them, you're there to sort of get help with issues that you're having, and they seem bored or like they don't care or they're not interested in what you're saying, you're not going to have a good time. They're not going to be very helpful. And even if that's just a perception. So they may be interested. They may be engaged and care about what's going on. But if your perception as the interviewee, as the client, is that they don't, that doesn't what the interviewer thinks doesn't really matter. You're not going to get as much out of it because your perception is that they're not good or they don't care. When the interview was seen as sort of warm and open, concerned, involved, committed, interested, caring, supportive, non-judgmental, all these sort of good things. All those things were incorporated with being seen as being good. Now, notice, this is about interviewers, but this also applies to sort of clinicians, clinical psychologists, that most of the time these things are more important, not necessarily the quality of the advice or stuff they're getting. So most of the time, people, when they go to see a counselor, they think they're going to go there, the clinician's going to tell them how to fix the problem, and then they're going to go fix it or whatever. And that's almost never what happens. Usually people go, they talk, the person listens, they give them, they show them that they're interested, give them support, show their concern, be warm and open, and give them a comfortable space with which to discuss these things. And the interviewee, the client themselves, are the ones that sort of tend to figure out their issues on their own with some guidance from the interviewer, the clinical psychologist. Responses to avoid in an interview. So you want to, avoid things that sort of increase stress. You want to avoid judgmental statements, things where you think, oh, that's not very good, or that's bad, or what, because it's going to put the interviewer on guard, and it communicates sort of disapproval to the interviewer. I'm sorry, the interviewee. You want to try to avoid making statements that evaluate them, sort of give them some evaluative sort of statement about how you feel about what they're doing. It's going to inhibit self-disclosure because they feel like you're judging them and evaluating their responses as being good or bad. They're likely to not really then divulge anything anymore. Which is why it's oftentimes good to find a clinician, a person that's going to do the interviewing, who has a specialization in the field of which you're concerned, because they're going to have more experience and have more proper responses and things about that particular disorder. Keep on going. Oops, hit the wrong button. So other things to avoid. Probing statements should be used carefully. So with that being said, like the whole point of doing an interview is the ability to have follow-up sort of probing questions, to be able to adapt and have a more efficient way of collecting data. But you got to make sure that they're not just vague, open-ended questions, and you have to sort of think about how to follow up. So oftentimes with clinicians and interviewers, you'll see that they'll avoid the term why. They won't, why did you do this? Because to ask somebody why, so they say something like, oh, whatever, we fill in the blank with whatever the problem is, and they say, well, why? It automatically triggers a sort of defensive response, like they have to explain themselves, like they have to rationalize to you why they did what they did, and it may require a respondent to reveal more than they are comfortable revealing in the short term. At times, probing statements are necessary, but you got to sort of pick the right timing and level of comfort in the interviewee. So in general, it's better to ask sort of how, rephrase the same why question into a sort of a how question, and just by simply doing that, you will likely lower the defensive-ness. So, for instance, I don't know, let's say someone's issue is, I don't know, they're I'm trying to think of a good example, and I'm blanking out. Someone's during an interview, they say, why did you? They're explaining why they committed committing a crime or something. You say, well, why did you commit the crime? That way, again, gets at their sort of motivation and stuff, which may make them defensive. But you can actually say, well, how were you able to, to do that, and rephrase the question in terms of the sort of hows of the problem instead of the why. You can get the same information, but get it a little bit slower, more incrementally, and not have the interviewee be as defensive and on guard by simply asking them the why question. So here's an example. So instead of saying, why did you yell at him? So let's say you think about these are two kids and they're fighting and one kid's yelling at another kid. If you actually say, well, why did you yell at him? You're more likely to get a more defensive response, where you could just say, okay, well, tell me what happened. Right? Well, how did you happen to yell at him? So that's a weird phrasing. Or like, what led up to this situation? So instead of just being specific at why, because the why did you yell at him has a bit of a connotation of almost like blame, right? So, which is why it makes people defensive. Why did you say that? So you can say, oh, can you tell me what you mean? Not sure I understand, which is a good one. It gets used a lot with interviewers. Sometimes just not saying anything, just being silent, will oftentimes give an interviewee the impression that you don't fully understand because you're not sort of confirming, and then they'll on their own sort of start to explain more details. Again, the how did you happen to say that? That's a sort of weird phrase. I mean, I guess it works. It just seems clunky. Like, why can't you sleep? Tell me more about your sleeping problem. Can you identify what keeps you from sleeping? How is it that, again, how is it you're unable to sleep? But removing the sort of why out of the questions and making it more about, tell me more about that. Can you give me, some more explanation about what happens there? Those things, they tend to make it seems more like a conversation that you're having between you and the interviewee than it does more. When you start asking the why questions, it seems like more like an interrogation, where these make it seem much more like you're having a conversation and trying to really get at the information and not interrogate them. Okay, so it seems to make it less blame-oriented. You want to avoid sort of hostile statements when interviewing, so unnecessarily trying to gather information. So the hostile statements meaning, accusatory things, inflammatory things. Sometimes most of the time you shouldn't do it. But sometimes there's something called a stress interview where you're actually trying to induce those characteristics to get information that's going to be done that way. But people have to have sort of experience to do that. But you want to try, if the whole point is if you're trying to get information, what you want to do is get information out of somebody. If you respond to them in a hostile way, they're not going to be open and willing to share information. It's going to close them right up. This goes in a lot of professional areas of any sort. This is something that doctors and hospitals sort of know, but especially interviewers and clinicians, is not to give false reassurance. And it's something that we really have to fight as people. We tend to want to tell some people, I'm sure everything will be fine. It'll all work out in the end. This is things we want to give people the easy reassurance because in the short run, we think it's going to help them feel better. If you just wait long enough, things will be fine. And the thing is, we have no way of knowing that. So do not give a person reassurance when it is possibly unwarranted. So when someone comes, if you're a clinician and you're talking to someone about their eating disorder or their anxiety or whatever, don't reassure them as saying, we're going to figure this out. You're going to be all better. It's all going to be fine. And those kinds of reassurances are empty. And it's just, you can't actually reassure them that. So if things don't turn out all right, you're not going to be seen. You may actually receive some of the blame for why it isn't all right, at least sort of emotionally. Right? Some effective responses. So with open-ended questions, those that cannot be answered specifically, right? So you can't just give them so we talked a lot about sort of creating items and scales, or Likert scales, where you have a statement and they mark it down or whatever. Open-ended questions, this is where, especially if you're going in, you don't really know exactly what the information is you're trying to get at. There could be numbers of different things, and to ask specific questions may either be too crazy, like it's too many questions, or it just may not be possible. So oftentimes asking open-ended questions like, well, can you tell me about this, and just have people openly respond about it without actually asking specific questions can be better than closed-ended questions and they're sort of in between, sort of like a scale and an interview, right? So these are open-ended questions. People can respond in any way they like. You can probe for further information. Open-ended questions promote the flow of information. So if you ask questions that are closed-ended, meaning if you say like, do you have a cat? They're going to say yes or no. But if you say, oh yeah, well tell me about any pets you have. So that's a more open-ended question where they can talk about their fish or their bird. You don't have to go through and ask them a bunch of questions for every single kind of animal they might have ever had as a pet. Open-ended questions can get that information much faster by letting them sort of decide or to guide the way in which it gets answered. Open-ended questions promote the flow of information, provide a wider range of area for the interviewer to explore. So as they start to respond, right, they can decide on follow-up or probing questions to sort of get more into those. So, however, sometimes closed-ended questions are necessary if you want specific information. If someone keeps avoiding a certain question, in open-ended questions, certain things they just don't talk about, you may have to switch over to a closed-ended, more specific, direct question to get them to answer that question and fill in that information. The interviewing skills is probably the last thing we'll talk about. Interviewing skills require not only knowing what questions to ask, but sort of how to ask them. Again, going from why to how, just sort of how to phrase questions. So think about, does your baby have any problems sleeping? Versus, what time does she usually go down for the evening? Does she sleep through the night? How many times does she awaken during the evening? How easily does she get back to sleep? When is she up for the day? Is she a morning, afternoon napper, or just a once-a-day napper? How long does she nap for? Do you ever awaken her for meals? So if you ask a question like this, it's much more open-ended. Does your baby have any sleeping problems? And they go, well, no. You may have to follow up with some of these, but oftentimes, a lot of times people will answer a lot of these sort of questions by simply asking them a much more open-ended question and sort of giving them some time to just sort of respond. Okay. It's not necessarily about which one's preferred. I should clarify that to you. It's not about better or worse, but sometimes it's about sort of the type of question you need to ask to get the information you're looking for. Right, so if you ask this more general open-ended question, and the person's able to talk about the sleeping issues or whatever it is, a lot of this information may be covered, but it may not be covered as specifically as it could be. Like, you may not be able to give the exact answer, but maybe that's not what's important. But if what is important is specific answers to some of these other questions, this item may have to be followed up by some of these. But if you start with this, oh, what time does your baby go to sleep? You're going to end up asking every single one of these questions. Right? You're going to have to go through a whole laundry list because you started with a very specific question. Now you got to follow it up with more and more specifics. Where asking this one is good if you just want general information about their baby's sleeping habits. You may not be able to get all this information, but maybe you don't need it. Maybe you don't need all this stuff. Maybe you just want to just get a general idea. This question is going to be better. If you really need every single detail of all these questions down here, you may actually have to go through and do these, even as follow-ups for the first one. So it's not necessarily about this one's better, this one's worse. It's about knowing how to ask the right questions to get the information that you really need. More general questions can be handled by something like this, but if you really need specifics, you're going to have to actually get real specific of things. Because sometimes you'll be like, oh, when does she sleep? And they're like, oh, she sleeps like most babies. You're like, all right, well, that's not what I want to know. Is she morning? Does she take a nap in the morning? So sometimes you have to sort of dig in and get really deep, especially people who aren't very forthcoming with their information. So sometimes you got to learn how to rephrase questions, learn how to ask questions in different ways to really get at the information that you really want. So this may work for certain times, this is fine, but you may actually have to rephrase this into very specific types of questions to get at a very specific answer you're looking for. That's what this is sort of talking about. And you have to figure these out while listening and being actively involved and making eye contact. Stuff like interviewing is tough.